Right, Miro, tell me what's going on with your knee.
So I had ACL surgery about a year ago.
Okay.
They took the ligament away from my hamstring.
Uh-huh.
And they put it on my ACL. But ever since then, I've had pain on my hamstring because that's where they took the ligament away from.
Uh-huh.
So now it feels really tight. Usually, even I stretch it out before I do exercise, and then even then when I'm doing exercise, it feels really tight. It kind of feels like a cramping sensation. And then also during exercise, when I started running, when I started accelerate, it kind of feels like it's going to cramp up, like kind of
your hamstring. Yeah, so hamstring. A lot of problem with the hamstring.
Yeah, hamstring. So I feel like so during my therapy, they focus a lot more on my knee exercises rather than my hamstring area. Okay. So they at the beginning they focus on just stretching out my hamstring before exercises, but then that was only during like the first month or so, and then after that, like the next like 4 or 5 months, they just focus a lot on just my ACL recovery. So I mean, my ACL it's okay, like it swells up sometimes after running and doing
your knee. Okay.
But really my problem right now is my hamstring.
Your hamstring.
It's really hard to stretch out and just.
It's very tight.
Yeah.
So. How much pain do you feel there from 0 to 10 in your hamstring towards?
If I don't do anything, it's just like around like 3. It's not that bad.
Constant pain, okay.
And then while I'm doing exercise, it's around like 5, and then after exercise is when it starts feeling even tighter. So I want to say around like a 7. It just feels like really tight. Very tight,
and you feel that in the hamstring area.
Yeah, in the hamstring area.
And you said you had a physical therapy before. Yeah. How long did you have the physical therapy?
I had physical therapy for about 4 or 5 months, and then after
5 months. Yeah.
After that, they just told me to just do that.
Do the exercise on your own. Yeah. Okay. So what did they do in the physical therapy?
The physical therapy was a lot. First of all, it was all just straightening out my knee. That's like the main focus at the beginning. And after that, it was just straightening out my thigh area.
But nobody worked on your scar tissue, your fascia, trigger points.
Scar tissue every once in a while, but they would just massage it with their hands.
Yeah, it's not effective to release the scar tissue. Yeah.
Like I had like kind of like a marble sensation like on my bone, kind of rubbing against it. So it would feel fine after for a little bit, but then
temporarily.
Yeah, I would just come back after the next time. By the time I came back to the next session, like I had scar tissue again.
So the way we assess your tightness is like bending and stretching your hamstring. That's when you feel it.
Yeah.
Okay. So so you had that's been going on for a year, and you had therapy for 5 months before coming to see me.
Yeah.
Yeah. Okay. So let me assess it first. Let's take your shoes off, and I will have you lie on.
Really tight.
How much from 0 to 10? We can see that in your face. Yeah.
Probably like a 6. It feels
5 and 6.
Yeah.
You're getting everything, yeah? Okay, alright, so let's lie on your side facing this way. Okay. So make sure this does not aggravate your symptoms, okay? And can you get the pillows, please? Have you had any other treatment than physical therapy?
No.
Okay. Just exercises and massage.
Yeah.
Okay. So give me feedback about how you feel. So do you feel the tightness in here?
Yeah, it feels a lot like like this area.
That area?
Yeah.
Okay. Alright. So I'm gonna release your fascia first, and then I'm gonna work on the scar tissue. Is that painful?
No.
Okay. And you said you have knee issue too, knee pain, or just your problem in your hamstring?
It kind of swells up a little bit.
Okay.
After exercise.
After exercise, that's okay.
Sometimes it's like a locking motion, like a little crack when I bend it.
Okay, let me know if you feel pain with that.
Okay.
Oh, you feel that?
Yeah.
Is it painful or is it okay?
No, it feels fine.
Okay, so after working on this, I want you to compare between the ASTR instrument and the massage, okay? Let me know if that's too much. How's that feel? You hear that? It's like washing board?
Yeah.
Yeah.
I can feel it. It feels like a...
Yeah. Are you guys able to hear that? Yeah. Okay. So, is that too much? It's okay. Yeah. It's right here. Scar tissue. Is that too much? Okay, don't let me move it, okay? So you get some motion on your pants. So it's right here.
Yeah.
Relax. Here. So this is the area here, yeah. Any problem with your calf?
No.
Yeah, your calf is feeling fine here actually. Feel that? How nice and smooth here. So you're hamstring on this side or the other side too?
It's just on this side.
Other side. Okay. So actually, let's. You comfortable lying on your stomach?
On my stomach, yes.
Yeah. Okay. So I will have you have this pillow underneath your stomach and just like your stomach. Okay, but no, it's okay. Yeah, you feel that? You see that? Actually, visually you can see the hamstring is tight here. It's really tight. Is it too much here?
No. Yeah, I can feel like feels like bumpy. Like.
Yeah, can you see it in the instrument? It's very easy to see actually. It's like swirling, you know. It's not going straight. Now it's breaking down. Here you go. How does that feel?
Feels good.
And you can see in the instrument it's bumpy. You will not be able to get that feeling with this massage, like using your hands. It's hard. It's hard on the therapist actually to break the scar tissue. I feel bad for those therapists that actually try to break it with hands. And you need to have like really good ergonomically designed instrument to save your hand. Is that painful here?
A little bit.
Make sure it's not aggravate your symptoms, okay? How does it feel?
Feels good, right?
Feels good, okay. Here? You feel that?
Yeah.
Oh, sorry. Okay, what about now?
That feels fine.
Yeah, get the big knots there. Alright.
Yeah, all they told me to do for my hamstring was to use a foam roller.
Yeah, it's not effective. Foam roller, just roll it over. Yeah, studies actually showed it's not really the best option to. Well, you have to break the scar tissue. It's like masking the symptoms, all of that. When you stop foam rolling or you stop stretching, you actually your muscle get tight again because it's not going to break the scar tissue. It's not going to release the fascia. It's not going to release the trigger point or muscle spasm. So we need to get to the source of the problem instead of just masking the symptoms. So a patient will experience long-term, pain relief. Okay, so let's lie on your back. Bend your knee and tell me how that feels. Can you tell the difference?
Yeah.
Mm-hmm. Okay, let's try to stretch. Let's see here. Stretching. Do you feel it still? Oh wow, look at that. Are you showing off now or what? Oh, look at that. It was here. Yeah, that's awesome.
Yeah, it feels way better because whenever I would do this, it just feels
you were touching this.
Yeah.
You were above your knee. That's nice. Let's think about the treatment compared to the 5 months of physical therapy.
Yeah, I think the physical therapy was like really painful. It was kind of like temporary. Like it would be gone. The scar tissue would be gone for like a day or two. Then once I would go back, they would massage it again. But it would just be painful. Like it felt like it was just like a marble like on my bone, just like rolling around. And they never really worked on my hamstring, so I think that's why like my hamstring is just tight ever since then. Like I felt like I was cramping up. So I think now like it just feels way more loose, and I feel like now I don't have to worry about like cramping, like feeling that cramping sensation. Like sometimes I'll be running, I'll just like kind of like just like pull up, like 'cause I just feel really tight. So I mean, now like to stretch out, like I don't feel anything.
You don't feel it, the constant 3 out of 10 pain that you don't feel it, and when you stretch, you don't feel the 7, 8.
I don't feel anything right now when I
Beautiful.
stretch.
Yeah, thank you so much.
Right,
thank you. Awesome. Good job.